Hey there, I am Dextran and I have different names. You can call me Dextran 40, LMD with 0.9% sodium chloride, Gentran 40, Rayumacrodex, Infed, Dexferrum, Gendex 75, Gentran 70, and Macrodex. My chemical name is. For my drug classification, in terms of therapeutic effect, I am a plasma volume expander, and in terms of pharmacologic effect, I am a glucose polymer. For my pregnancy category, I am at pregnancy category C, wherein I should not be used during pregnancy only if the benefit outweighs the risk. US FDA pregnancy category is not assigned. Risk summary: animal reproduction studies have not been conducted with this drug. For my mechanism of action, in terms of plasma expanding action, I am a monovalent heptene and reacts with dextran reactive IgB without a breach formation, so there is no tendency for large immune complexes to form. Given before me is the dextran 1 complex, competitively prevents immune complexes of polyvalent dextrans from forming, thereby impeding anaphylaxis. In terms of prophylaxis of venous thrombosis and pulmonary embolism, I inhibits vascular stasis and platelet adhesiveness and alters structure and lysability of fibrin clots. I also increase cardiac output and arterial, venous, and microcirculatory flow and reduces mean transit time, mainly by expanding plasma volume and by reducing blood viscosity through hemodilution and reducing red cell aggregation. I am administered IV. Plasma level depends on rate of infusion and rate of disappearance of drug from plasma. For distribution, I am distributed throughout the vascular system. For metabolism, my molecules with molecular weights above 50,000 are enzymatically degraded by dextranase to glucose at about 70 to 90 milligrams per kilograms daily. For excretion, I am rapidly and completely excreted by glomerular filtration. In terms of my route, I am administered IV. My onset is immediate, my peak is immediate, and my duration is unknown. I am indicated for fluid replacement and certain types of shock if whole blood or blood products are not available. Priming fluid and pump oxygenators, prophylaxis of venous thrombosis and pulmonary embolism associated with high-risk thromboembolic surgeries, and improve circulation in sickle cell and MI patients. I am contraindicated to those hypersensitive in me, to those who have CHF or congestive heart failure, renal failure, thrombocytopenia, hypofibrinogenemia, and severe bleeding disorders. Also, special precautions with patients with or at high risk of heart failure, active hemorrhage, diabetes mellitus, chronic liver failure, risk of pulmonary edema, and correct dehydration is needed prior to administration. I am also not intended as a replacement for whole blood or blood components, renal and hepatic impairment, and pregnancy and lactation. For my side and adverse effects, in the CNS includes fever, in the CV includes thrombophlebitis, hypotension, and bradycardia. In the ENT includes nasal congestion with high molecular weight Dextran, where GI includes nausea and vomiting. In the GU includes tubular stasis and blocking, increased urine viscosity, oliguria, anuria, increased specific gravity of urine with high molecular weight Dextran. In the hematologic includes increased bleeding time with higher doses of low molecular weight Dextran, increased bleeding time, and significant suppression of platelet function with high molecular weight Dextran in doses of 15 mg per kilogram body weight. In the musculoskeletal is arthralgia, and others includes hypersensitive reactions such as urticaria and anaphylaxis. For the nursing responsibilities, in the assessment, before taking me, assess allergy history. Most colloids can cause allergic reactions, although rare, so take a careful allergy history, asking specifically if they ever had a reaction to an IV infusion before. Next is document baseline data. Before infusion, assess the patient's vital signs, edema status, lung sounds, and heart sounds. Continue monitoring during and after the infusion. Evaluate patient state of hydration before Dextran therapy begins. Administration to severely dehydrated patients can cause renal failure. For the implementation, if blood is to be administered, draw a cross-match specimen before Dextran infusion. In preparing IV infusion, use only if seal is intact, vacuum is detectable, and solution is absolutely clear. For administering IV infusion, specific flow rate should be prescribed by physician. For emergency treatment of shock in adults, give first 500 ml rapidly. Example, 20 to 40 ml per minute. Give remaining portion of the daily dose over 8 to 24 hours or at the rate prescribed. Lab test, baseline HCT or hematocrit prior to and after initiation of Dextran, as Dextran usually lowers HCT. Notify physician if HCT or hematocrit is depressed below 30% by volume. Monitor vital signs and observe patient closely for at least the first 30 minutes of infusion. Hypersensitive reaction is most likely to occur during the first few minutes of administration. Terminate therapy at the first sign of hypersensitive reaction. Monitor CVP as an estimate of blood volume status and a guide for determining dosage. Normal CVP 5 to 10 centimeters H2O. Observe for SNS of circulatory overload. Note, when sodium restriction is indicated, know that 500 ml of Dextran 40 is 0.9% normal saline, contains 77 MEq of both sodium and chloride. Note, bleeding time may be temporarily prolonged in patients receiving more than 1,000. For patient teaching, educate the patient to report immediately if there are signs and symptoms of bleeding, such as AC bruising, blood in urine, or dark tarry stool. Do not breastfeed while taking this drug to report oliguria, anuria, or lack of improvement in urinary output. Dextran usually causes an increase in urinary output. Discontinue Dextran at first sign of renal dysfunction. And educate the patient that high doses are associated with transient prolongation of bleeding time and interference with normal blood coagulation. For the evaluation, monitor patient response to drug therapy, such as urinary output, blood pressure, cardiac output, tissue perfusion. Second is monitor for adverse effects, such as nausea, vomiting, hypotension, urticaria, pulmonary edema, etc. Third is monitor patients' understanding the drug or Dextran therapy. Fourth, monitor patients' compliance to drug therapy. Thanks for watching. I hope you learned a lot.